Okay, yeah. Good evening, everyone. I hope I am audible and as well as visible. Okay. Okay, good. So yes, let's start the session. So first of all, introduce myself. Dr. Ankit Khandelwal. I am MBBS and MS in anatomy, and I am a faculty of anatomy in the Unacademy Plus platform. Okay. So this is a session for our preclinical subject, that is anatomy, and mainly for the first year students as well as those who want to have some idea what the brachial plexus. So the topic chosen over here, okay, thanks Shubham, is the brachial plexus concepts. Name Dr. Ankit Khandelwal and the credentials over here. So okay, let's start with the brachial plexus now. So brachial plexus is what? Very good. Good evening to all of you. What is brachial plexus? Brachial plexus is a collection of nerves. It's a collection of nerves which supply the upper limb musculature in a whole, not just musculature but everything in the upper limb. So that is the brachial plexus. So it's basically coming from our spinal cord. So we are discussing only the concepts over here. This coming from the spinal cord. Which part of the spinal cord? The spinal cord we know has all the different segments. So this one is coming from the spinal segments, mainly from C5 to T1. So we have C5, we have C6, we have C7, we have C8, and we have T1. We have T1 over here. Okay. Remember, in the cervical we have 8 cervical nerves, though vertebrae wise cervical has only 7 vertebrae. So they will come out from the spinal cord. They will come out from the vertebral column through the intervertebral foramina, and as they come out from the intervertebral foramina, the spinal nerve is actually that is at the intervertebral foramina. But as it exits from the intervertebral foramina, the spinal nerves divides into a ventral ramus and a dorsal ramus. A ventral ramus and a dorsal ramus. Remember, this dorsal ramus mainly supplies what? It mainly supplies the area on the back, not the whole back, but in the medial part of the back, the true intrinsic muscles of the back, and a small patch of skin close to the median plane on the back region. Okay, so that's the function of dorsal ramus. The rest of whole body is basically innervated by the ventral rami. So when we talk of these nerves forming the brachial plexus or lumbar plexus in lower limb or lumbosacral plexus, we are basically dealing with the ventral rami. We are basically dealing with the ventral ramus or ventral rami. So these mainly five. If it is C4, we call it as a pre-1, and after T1 we call it as a post, because that is after T1. Normally in most of us it is C5 to T1. Now these parts of ventral rami, they will come out from the vertebral foramen or vertebral column, and they'll start to talk to each other. Talk to each other meaning by C5 and C6, their ventral rami, they will mix up and they will form a upper trunk. They will form a upper trunk over here. C7 goes distally and it is like simple as the middle trunk over here. C8 and T1, they will also combine and they will form the lower trunk. So the rami, they form the trunks over here, the upper, middle and the lower. So they are 3 trunks. They are 3 trunks. Okay. Now what happens after these trunks are formed? After these trunks are formed, these trunks will soon, all of these trunks will soon divide into the 2 divisions. Divisions, these are V and D. I hope you understand, that is ventral and the dorsal divisions. So these are the divisions. These divisions, I may write over here divisions, and I may write over here the trunk, and I may write over here the roots. Though it is a ventral rami, but for the convention we start calling it as roots only. Now these divisions are formed. Now what will happen after these divisions are formed? These divisions, they will try to talk to each other and they will combine. The ventral division of the upper and the middle trunk, the ventral division of the upper and the middle trunk, they will form a cord. This cord is known as a lateral cord. Sunita, very good question. Difference between rami and root. Okay, so just after this particular slide, we'll discuss the difference between rami and root. A good question. First of all, now ventral divisions of the upper and the middle trunk, they form a cord known as the lateral cord. Fair enough. The other one over here is the ventral division of the lower trunk. It continues as the medial cord. It continues as the medial cord. Now see, everything is going from proximal to distal, or otherwise we can understand going from medial to lateral, because this is the spinal cord over here in the vertebral column, roots, trunk, division, cord and the branches. So they are coming from here to here through the axilla. So medial cord is formed. Last not the least, we have one more cord, and that is known as a posterior cord. So all these dorsal divisions, all these 3 dorsal divisions, they will combine and they will form a cord, that is your posterior cord. So these 3 cords are ultimately formed. So let us write below over here root, trunk, division and the cords. Now these cords are placed where? their position is in the axilla. We'll just look where how the position is over there. Now these chords will they will start to give off the various branches. I'm just writing branches over here because we'll write in the next slide what are the various branches. So you have 3 chords over here: lateral, medial and posterior chord, and you have their branches in for the upper limb. We repeat again what is happening over here. What is happening over here? So try to understand. Roots is formed where it is most medially over here. So where will you see the roots? So basically we call it as roots conventionally, but actually it is a ventral rami of C5, 6, 7, 8 and T1. Actually it is ventral rami. Conventionally we call it as roots. Roots is a totally different thing that is inside the spinal cord. We'll show you where. So what is the location of these roots over here? The location of the roots is around the interscalene or between the scalene muscles, scalene anterior, scalene medius muscles. So that is said to be in the interscalene groove. That is found where in the interscalene groove. Very, very important question nowadays, the location. Now these roots are forming the trunk. The question is, where will you find the trunk in a patient? Trunk, if you remember the head and neck, we have the anterior triangle and the posterior triangle divided by the sternocleidomastoid. The trunks are located in the posterior triangle of the neck. The location of the trunk is in the posterior triangle. Showing the figure also, but first have an idea what is this brachial plexus, then we'll look at. Then root is over here. Trunk is over here. Okay, then it will go down as a division. Now divisions are found where? Behind the clavicle. So we call it as location is retroclavicle. So behind the clavicle where the division, now they will go down into the axilla. So the chords are found in the axilla, and it is from the axilla when the chords will start to give off the various branches. So we have the root, trunk, division, chord and branches over here. If you understood this, then we can move to the next slide. So root, trunk, division, chord and branches. Location wise, we understood interscalene groove, triangle, posterior triangle, behind the clavicle, axilla, and chord branches will be obviously in the axilla, was going towards the upper limb. Now the other thing over here is this root, trunk, division, chord branches. If you are actually having problem, there's a mnemonic: right to drink chilled beer. Okay, so that is, but not promoting anything over here, but it's just trying to make you remember right to drink chilled beer. This is how I remembered it when I first tried to remember it. Okay, right to drink chilled beer. So this is R, T, D, C and B. Okay, so that's the mnemonic over here. Okay, so the location clear. How they are formed is clear. Now we have a question from Sunita that what is the difference between root and rami? Very good and legitimate question. Try to understand over. This is the spinal cord, section of the spinal cord. We had made it quickly over here. This is the gray matter over here. That is the anterior part, that is the posterior part. Okay, now look at the dorsal root. So these will be the dorsal root ganglion, DRG. Now these are the dorsal root which will going into the posterior horn. These are the dorsal roots. I am writing D dot root over here. Okay, these are the dorsal roots. And if you take this another color for the gray matter over here, anterior gray horn, these are the cell bodies of the motor root, and motor root will come out like this. These are the motor root. These motor root and this dorsal root, this green colored dorsal root, they will actually combine over here and they form the spinal nerve. The location of this spinal nerve is in the intervertebral foramen. Okay, between the vertebrae there is the intervertebral foramen. They actually mix over here, and what comes out from this is the ventral rami after mixing in, and a very thin dorsal rami. So dorsal rami is this, which I told you supplies the back region, and this is the ventral rami, this supplies, which is basically forming the brachial plexus and all the others. So there is a difference between rami and the root, actual difference, but conventionally the rami is over here for the brachial plexus are conventionally called as roots. Simple, they are conventionally called as roots. So we have to take a landmark over here. I guess this point is clear, Sunita? Okay, yes. So this division landmark over here is the bone over here, that is the clavicle, that is a landmark. What does it mean? It means that, common sense, medial to lateral, proximal to distal, this is how the brachial plexus is going, medial to lateral, proximal to distal, or superior to inferior. I mean, superior is over here, see, this is our neck over cervical region going to the upper limb, superior to inferior. So above these divisions, all these branches which are coming off, they are said to be the supraclavicular part of the brachial plexus. Okay, and whatever is distal to the divisions, that is said to be the infraclavicular part of the brachial plexus. That is said to be the infraclavicular part of the brachial plexus. Okay, so this is again, recently they are asking so many questions about all of these. Recently the questions mainly are, where is the location of the individual part of the brachial plexus that I told you, then what are the supraclavicular and what are the infraclavicular parts and their branches. These questions are asked. So now let us look at a figure over here. Look at a figure over here. The same thing which we discussed over here. Now if we have an idea, we can understand the figure very well. The roots bracket, it is written ventral rami, just for the sake of understanding. Then the trunk, division, chord and its branches or the terminal nerves. Roots you can see from C5 to T1. Upper C5, C6 they will meet, forming the upper, middle and the lower. Middle by C7, lower by C8 and T1. All of these will give rise to the ventral and dorsal divisions. Dorsal divisions here are written as posterior ones with this you can say the light purple color, and the ventral divisions are this yellow color. You can see the ventral division of the upper and the middle trunk, it is forming the lateral chord. The ventral division of the lower trunk is forming the medial chord, and all these dorsal divisions they form the posterior chord. Okay, so remember this division is behind the clavicle. So these are the supraclavicular, these are the infraclavicular, and over here these are the supraclavicular area of the brachial plexus. Point clear? This point is very important. Now the question comes nowadays that, okay, what are the supraclavicular branches of brachial plexus, what are the infraclavicular branches of brachial plexus. Now infraclavicular, we have three chords over here, lateral, posterior and the medial chord. They give a lot of branches. Okay, like they give around 13 or 14 branches are coming from the chords, but luckily around 4 or 5 branches comes from the root and the trunk. So better to learn in the question, for the question as I am telling you, if they ask you the supraclavicular or infraclavicular, you should know that which are at least number one. So better first, if you are reading it first hand, you should know at least what are the supraclavicular branches, because they are not in much in number. So supraclavicular branches, they will come from the roots as well as from the trunk. Division is another new question which I saw. Division is the a part of the brachial plexus which has no branches. So division over here, it gives off no branches. So that is another question, just remember it. Okay, mnemonics will definitely work over here. But first look at the branches coming from the roots and the trunk. You can look over here on the branches coming from the root, dorsal scapular nerve, and this is the long thoracic nerve. So these are two nerves over here, dorsal scapular and long thoracic. They are coming from the roots. Okay, they are coming from the roots. I will tell you the mnemonics later on, but first the root and trunk. Now dorsal scapular nerve, let us take another slide for understanding it. See, dorsal scapular nerve, okay, and the second one was our what? It was our long thoracic nerve. Long thoracic nerve. They were coming from where? They were coming from the roots. They are coming from where? They are coming from the roots. Root is where? Medial or lateral? Yes, root is where? Medial or lateral? It is obviously, it is a starting point, so that is going to be our medial. So the branches coming from the roots, listen very carefully, this important concept or trick is very important to understand. So the root is giving off some branches. It will give off the branches which will supply the muscles or the area of the upper limb, which is also medially. Why? Because the root is medially. Therefore the dorsal scapular nerve is going to supply the levator scapulae muscle, is going to supply the rhomboids, where we include both the rhomboideus minor as well as rhomboideus major. Where are these two muscles? If we look at here, if we look at the posterior part of the scapula, right scapula, these muscles are located right on the medial part, levator scapulae, rhomboideus minor, rhomboideus major. They are attached to where? They are attached to the vertebral column over here. So where are these muscles? More medially. Second, the long thoracic nerve is going to supply what? It is going to supply our serratus anterior muscle. Serratus anterior muscle, very important muscle, but where is its location? That is also important. Serratus anterior muscle is coming from the medial border of the scapula and will go and attach to the upper 8 ribs. So this muscle is again more medially. So the medial muscles are supplied by branches which are coming from the root, So in some way you forget which roots giving of which branches. They are giving branches which are supplying the muscles which are present more medially. Then we come to the other part, that is the trunk. Trunk, we have 3 trunks, the upper, middle and the lower. Out of these, only the upper trunk is the one which gives off the branches. The middle and the lower trunk, they don't give the branches. So apart from divisions, you also have that the middle and the lower trunk, they also will give no branches normally. So what is the upper trunk giving of the branches to? Okay, upper trunk, you can have a look in the previous slide also. We can have a look over here, the suprascapular nerve and the nerve to subclavius, the two S over here. So these two are suprascapular nerve, and the second one was our nerve to subclavius, subclavius. Now if you look at the whole picture over here, again the scapula may help you. You look at the scapula, where the suprascapular nerve is supplying what? Suprascapular nerve is supplying the supraspinatus muscle and the infraspinatus muscle. So just think, root is giving branches over here, trunk is giving the branches over here. Just we are going medial to lateral or proximal to distal. Okay. Second one is nerve to subclavius. So if we imagine that the clavicle, where would be the clavicle? Clavicle is present anteriorly and it forms the acromioclavicular joint. The subclavius muscle would be present below the clavicle like over here. So same, the upper trunk is giving off the branches to these muscles, which are just distal to the branches which are given to the muscles which are coming from the roots. I guess you understand what I mean from there. Okay, so the upper trunk is giving these branches. So remember, these are the branches which are given off by the roots and the trunk. Now here is the update. Here is the update. You can just note it down somewhere. Suprascapular nerve, normally it comes from the upper trunk, but make a note over here, it may directly come from the roots. It may come from the roots. It may directly come from the roots also. It's not mandatory that suprascapular nerve will only come from the upper trunk. So remember that. Why I'm telling you? Because there was a question that all of the following branches are, or which of the following is a branch from the upper trunk of the brachial plexus. In that both of these options were given. If both of these options are given, then that's common sense that we have to go with this answer, because this may come from the roots, but this normally comes only from the upper trunk. Okay, so these are your few branches from the root and trunk. Now as we go more distally, division giving of no branches, chords. Now chords branches are important and very important, and we can see what are those branches, and mnemonics are going to help us over here. So what mnemonics are going to help us over here? Just a quick overview. Lateral chord. Okay, the mnemonic is LML. LML, I hope you remember. I mean, yesterday there was a big brand for the automobile industry, was LML, but yes, now it is not that much, but LML is scooters, LML this and that. LML is what? LML is lateral root of median nerve. Second L is your lateral pectoral nerve, and this M over here is musculocutaneous nerve. Musculocutaneous nerve. Okay, these are the three branches from the lateral chord. Then we come to the another chord, and the next chord over here that we can discuss is our, say, the medial chord. Our medial chord. Medial chord, there is a mnemonic. The mnemonic for the medial chord goes like 4 times M and a U. So we used to remember it by M for U. M for U, 4 times M and a U. What are these two? What are these M and U referring to? There are two, lateral root and lateral pectoral, same for the medial. That is the medial root of the median nerve, of the median nerve. Median nerve, and this is the medial pectoral nerve. Medial pectoral nerve. These two M's are the medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. And this U will stand for the ulnar nerve. This U will stand for the ulnar nerve. So ulnar nerve, musculocutaneous. Now you can see over here the question comes, which of the following is a terminal branch of XYZ or whatever chord? You can see that out of these three nerves, it's the main musculocutaneous that will go to the arm and forearm. So this is the terminal, or you can say the continuation of the lateral chord. And as the ulnar nerve goes to our hand, so that is a terminal branch or a continuation of the medial chord. That is a terminal branch of the medial chord. So these two chords. Then we go to the another chord. I will just show you this diagram. But first of all, let us name the branches. The other one is our posterior chord over here, the posterior chord. The mnemonic is ultra or ulnar, whatever you want to call it as, but let me write one mnemonic at least. Ulnar, I guess you remember ulnar or ultra also. U and L are our upper and lower what? Subscapular nerve. Upper and lower subscapular nerve. U is for upper, L is for lower subscapular nerve. And over here is nerve to LD, that is latissimus dorsi. Bracket I am writing also known as thoracodorsal nerve. Why thoracodorsal nerve? This muscle is where? This muscle is located at the dorsum side of the thorax, lower thorax. Or you can say it actually reaches the thorax but coming from the lower part of the trunk on the back side. So thoracodorsal. Dorsal means a muscle of the back. So this nerve goes to the back region, thoracodorsal nerve. A is our axillary nerve and R is our radial nerve. So you can see the terminal branches are those nerves which are going distally to the arm, forearm on the hand. So radial nerve becomes the terminal branch. And even the axillary nerve also will become, so because it supplies the deltoid and the teres minor, so yes, that will also become one of the terminal branches. So axillary nerve and the radial nerve. So how many terminal branches we have? We have two from here. One was musculocutaneous from the which chord? Lateral chord, and one was ulnar nerve from the medial chord. So we have 4 terminal branches, but there is one more terminal branch. There is one more terminal branch. Yes, ulnar or lunar. So yes, you can LU or UL, that doesn't make much of a difference. And yes, ultra is what? UL, T, R and A. So ultra is also used as a mnemonic. So anyways, you can use more mnemonics. So what were the terminal branches that can come as a question? Which of the following is a terminal branch except? So we know musculocutaneous nerve, we know the ulnar nerve, we know the axillary nerve, we know the radial nerve. Which is the 5th terminal branch, if I may ask you, anyone? Which is the 5th terminal nerve of the brachial plexus? The whole brachial plexus, 5th one is our, I guess you know, just writing over here, save time, that is the median nerve. So these are the 5 terminal branches. So let us quickly look at the previous figure over here. Look at the terminal nerves over here: musculocutaneous, median, axillary, radial and the ulnar. These are the 5 terminal branches. Terminal, why? Because they are going to the arm, forearm and the hand region. This figure over here is showing you the supraclavicular and the infraclavicular divisions. Very important figure. We are seeing it right now, but okay, we can understand it here also. You can see that these are the anterior rami, C5 to T1. So these are where the roots or the ventral rami are located. They will form what? The 3 trunks over here. 3 trunks are present where? In the lower part of the posterior triangle. Okay, also known as subclavian triangle or supraclavicular triangle, the lower part of the posterior triangle. Then the division is where the divisions are behind the clavicle, and they will give off the, they will combine, and all the chords will be actually forming over here. So the infraclavicular is basically all the chords over here, and this is your what? These are the 5 terminal branches. The 3 chords are being shown over here, and you can understand that the clavicle, behind the clavicle, the location of division. So infraclavicular is chord and its branches. Supraclavicular is branches from the root and the trunk. I just wanted to tell you over here how to understand it, how not to be so terrified by it. This is a location, this is how it appears. So root will give off branches, and root and trunk will give off branches to muscles which are more medially, and chord will give off the branches to everything. I mean, whatever it is later on, when whatever is distally, all the other except all the other muscles, they will be given off by the chords. Okay, so these are the few mnemonics over here. Let us see at one more figure, again telling you the same, the 5 terminal branches over. I guess that is clear. One thing over here is also there that may be asked. I'm just moving back to this figure. Sometimes students ask me that, sir, okay, that is all fine, but we are not able to understand what is the root value of X, Y or Z nerve and all. So remember how to learn the root value. You have to understand this whole diagram in your mind, keep that in your mind. So if I ask you, okay, tell me the lateral cord should be formed by which roots? Okay, lateral cord, sir, I know it is formed by ventral division of upper and middle trunk. Okay, then I will ask, okay, upper and middle trunk are formed by, you will say that it is formed by C5, C6 and C7. So lateral cord can have a maximum of C5, C6, C7 root value only. If I ask you, okay, fine, good with the lateral cord, tell me about the medial cord, what could be its root value? You will say medial cord, sir, yes. So sir, medial cord is formed by the ventral division of the lower trunk. Okay, then I ask, what is the lower trunk formed by? You say it is by C8 and T1. So yes, medial cord is, the root value is always C8 and T1. And same in the posterior cord, the root value, it is formed by all the 3 posterior divisions. So its root value can be from C5 to T1 maximum. Okay, so and have a basic idea that this could be root value. One exception over here is what? Is you can see this ulnar nerve. Ulnar nerve is coming from which cord? Ulnar nerve is coming from medial cord. Ulnar nerve root value can be only C8 and T1. But what is the root value of ulnar nerve? The root value of ulnar nerve is C7, C8 and T1. So that's an exception. And how to understand this exception? Look at this C7 over here. You can see this blue line. That blue line is coming, and this is the only root, only on part of the C7 which is going down, and it is mixing with the ulnar nerve. So in the ulnar nerve, that is an exception. Please do remember it. That the ulnar nerve is formed by, the root value of the ulnar nerve would be C7, C8 and T1. So have a rough idea, develop your concepts. Very important topic, brachial plexus. Why I choose this topic? Because this is undoubtedly the most important topic of the upper limb. So what about we talk of the nerve injuries, this and that, everything, but first of all we should be having a basic idea of what is the brachial plexus formed of, how it is formed of, what is the main questions. So humble request is go through all these branches, learn all those names, what are all these branches and all those names, and make a idea in your mind, okay, this is happening. Median nerve is formed by you can see over here, median nerve, I may show you, median nerve is formed by both these lateral root and the medial root. So therefore median nerve can have the root value of all of them. because lateral root by lateral chord C5, 6, 7, and medial root by medial chord C8 and T1. So medial chord can, or median nerve can add root value from all the C5 to 1, and that is the root value of median nerve also. So just apply your common sense. Remember the exceptions also. The exception was only this for the ulnar nerve. Remember that exception. So if you keep these few concepts in your mind, then things are going to be, if you understand the topic, then nothing like that. Finally, after this, let me update you that that's all for the day. You can develop your concepts. Whatever you have problem, just message. You can message me in an Academy app also. Just try to follow me in the Academy NEET PG platform. You will get me over there. An update tomorrow 10:30 a.m. I have a special class that is open class, or we can call it as a free class. I try to call it as a special class, better word, but it sounds good. Tomorrow 10:30 a.m. we are going to a special class on various MCQs from various topics from the anatomy only. So tomorrow 10:30 to 12, so it is going to be of 1.5 hours, 10:30 to 12. You can join, anyone can join who is interested in learning the concepts of anatomy with the help of few MCQs. Okay, so that's all from my side, and thank you very much for listening so patiently. So these are the sessions, small sessions for very important concepts which I can share with you, and you can also share with me a few things. Okay, so that's all from my side. Thank you for your time. Bye bye, and stay safe, and hope to see you tomorrow at 10:30 a.m. So you can also invite your friends also over there. Okay, bye bye, thank you.